Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Then, neuromuscular features which are seen in chronic renal failure. In chronic renal failure, the patient will present with encephalopathy. Then there is restless leg syndrome is seen in the patient. Then the patient can have peripheral neuropathy or impotence, or there can be dialysis dementia are seen in the patient with neuromuscular. These are the neuromuscular manifestations of chronic renal failure. One important thing is restless leg syndrome. In the restless leg syndrome, the patient will have the urge to move his leg. He has the urge to move one's body, and this will result in uncomfortable sensations of the body. This is because of uncomfortable sensations, because he has urge to move his own body to stop the uncomfortable or odd sensations that the patient has. So this mainly occurs in the legs of the body, and for this we can use the treatment as gabapentin can be used for treatment, or you can also use one more treatment which is called as pramipexole can be used for the treatment of chronic renal failure.
thank you and thank you for watching.